And now it's our pleasure to invite Charmaigne Weldon to come as one of our witnesses. Charmaigne, here you are. Good. This is Dr. Pringle, Helen Pringle, Mary Kerr, and Kerry Heubel. And Bashi Kumar couldn't be with us, but she will be here in spirit and working on the report that we're going to do. So please proceed with your presentation.
Thank you for inviting me. I think it's a very important point to have an Indigenous voice. I'd like to start off with acknowledging the Aboriginal custodians of Australia across the nations and pay my respects to my ancestors and elders past and present and emerging.
Thank you.
So this statement made by me sets out evidence that is true to the best of my knowledge and belief, and I make it knowing that reference may be made to in a report of the hearing and may be used in an NGO submission to CEDAW Committee during Australia's upcoming 9th periodic report at CEDAW's 86th session.
Thank you.
I have pursued CEDAW and the list of issues, questions prior to the submission of the 9th periodic report of Australia, and have considered these sections relevant to my area of experience and expertise, including Article 14 and 10 of CEDAW. I am aware and participate on the understanding that CEDAW hearings will be recorded online and transmitted by live stream via YouTube technology permitting. Forgive me if I do drop out. I've had a few little issues this morning.
We've had them too, so I'm sorry we're not live streaming at the moment.
Okay, good. I am a mother of 6 children and have worked in women's refuges and court support for over 20 plus years. My personal experience have given me the ability to raise awareness, highlight issues which are having an impact on our communities. I am a proud Aboriginal woman originating from the Walwyn, Gamaroi, Wiradjuri nations. I grew up in a small, remote New South Wales town, Galargambo. Blink and you'll miss it. At the age of 7 years old, I witnessed a murder of a family at a family function. My uncle was intoxicated during an argument with my aunt. He broke a broken bottle to inflict a fatal cut to my aunt's throat. My aunt was holding her baby at the time, and he was also cut across his cheek. I had to run home through a paddock to get my parents and bring them back. The nearest ambulance and police station were in Coonamble, which was a 40-minute drive away. In 2008, I was appointed to the Federal Government Consultative Committee to work on the National Action Plan to reduce violence against women and their children. For 4 years, I served on the committee, and in this role, I attended countless rural and regional consultations addressing the issue of violence against women in our communities. In 2016, I also had the opportunity to present at the United Nations 60th session of the Commission on the Status of Women, the CSW 60, on Aboriginal women and the judicial system. Although I currently work in Sydney, I continue to have opportunities to attend consultations and in regional areas. Recently, I attended a roadshow in regional area and learned how a young Indigenous woman attempted to commit suicide after discovering she was pregnant. She had been in a relationship for 4 to 5 months, and it was characterised by severe domestic violence. She had no car, no money, and her partner became violent and broke furniture when she was speaking about ending the pregnancy. She could not afford to travel to the city for an abortion. She had felt trapped and unable to call the police due to fear of how her family would react. She was only about 19 to 20 years old and tried to hang herself from a ceiling fan, but was fortunately rescued by her younger brother. This highlights the importance of having pregnancy terminations freely available to women on a public health system. There is no easy way to escape domestic and family violence when living in a small country town. Particularly in the if a woman does not have a car, there is no way to get away quickly or hide. The level of violence is often worse in the country because of greater access to weapons. Due to the distance involved, the response by emergency service is also slower. There is one refuge in Dubbo, but everyone knows its location. Young women and girls are often unaware of what services are available, anyhow, and relevant to disclose. Mothers with children are also reluctant to disclose because they are aware that mandatory notifications may result in the removal of their children, and therefore can also be recriminations within the community for making a report to police. Many women need the support of their partners, even if there is violence due to inadequate support from the welfare system. Community legal centres in regional areas are often ill-equipped and lack the necessary resources to support women. The issues with policing are ongoing, with police often unresponsive to women's reports and racist attitudes academia. There has been very little change. However, there is now an increasingly tend to unfairly identify women as a primary perpetrators when they are acting in self-defence. It is also difficult to access health services in regional areas. There are fewer doctors and they often don't bulk bill. There are very long waits in country hospitals. Unless you have private health insurance for a healthcare card, the cost of an ambulance can be prohibited, which results in cases of women giving birth on the side of the road. Even when an ambulance is called, there can be a long wait. In general, there is a huge difference in the responsiveness of services to rural women compared to urban women. In country areas, services are far more limited to 9 to 5 p.m. hours. Teaching staff in country schools are often inexperienced and not adequate trained to provide a cultural safe teaching environment. Although there are efforts to start teaching traditional language in schools, the staff doing this work are experiencing discriminatory pushback. Teachers who are Indigenous are often roles are often paid less than their non-Indigenous counterparts.
Thanks so much, Charmaigne Weldon. May I just ask a question before we hand over to colleagues? With that paragraph 12, and on the issue of the teaching of traditional languages in schools, which is a really important project, and we recognise that there have been real efforts to reclaim the original languages and so on. There's been a lot of work in this. But do you have any suggestion what could be done to address this problem of the staff who are working on these languages and teaching them, experiencing that discriminatory response to what they're endeavouring to do? Got suggestions?
I think it's so important that culture is being taught within our educational systems, you know, especially within primary schools, that's where the learning should begin. And it's across both primary and high school education sectors that most Aboriginal teachers are the ones that are equipped to teach language, where they're reviving most languages these days within Nyampa out in country, and Wiradjuri language is being recovered slowly. And the staff that are teaching these are qualified and have degrees and are very much underpaid compared to non-Indigenous teachers, which I find quite extraordinary, like discriminatory in terms of equality for Aboriginal women and men in the education system, teaching Aboriginal protocols and our culture and language.
Well, because it's a particular specialism and a real ability and a capacity, and yes, it should be honoured rather than seen as lesser. But let me hand over to colleagues. Perhaps Dr. Pringle or Mary Kerr or Kerry Heubel have questions for you, Charmaigne.
Yes.
I do. Obviously, the transport and access to hospitals and facilities like that, do you find there's an increasing amount of people that are Aboriginal that are leaving their community because they can't access those services?
Not so much like leaving the community, but they're suffering with issues like being able to get to specialised appointments, which could be in the next regional town, and you would find most elderly as well. You know, even though they run buses, those buses run on certain days, and if you miss that bus, then you've missed your appointment. So it's quite concerning for our elderly. They're not getting the health requirements. You know, in remote rural areas, and doctors are very few and between in terms of. There's probably one doctor in this one particular community that has been probably 80 years old, and there's no, like, doctors are very reluctant to want to be out in remote rural areas. So yeah, it's a big problem, that health issue in remote communities. You know, and most of our Aboriginal elders that suffer with high blood pressure, diabetes, and just being able to, you know, get to appointments. There's not a lot of services like compared to AMSs are very far in between, you know, like they're in regional towns more or less. So it's quite complex for the elders in community to get that, to get supports for health reasons.
Helen.
I was just going to just further to that question. The nurse practitioners that have been introduced, is that in any way assisting the distribution of medical services where there are limited medical practitioners? That is, the nurse practitioners that can take the blood pressures and do the tests. I know there has been a lot of resistance to implementing these nurse practitioners in many areas, but other areas have found them extremely helpful because it takes you might say, the time from the medical practitioner, so he or she can deal with immediate acute issues. I'm just wondering how helpful they have been or unlikely to be in some of those remoter areas where you've got a practitioner who's 80 years old.
Yeah, it's like, I guess, you know, it's the mobility as well, you know, of some elders in community don't like practitioners coming to home, I guess, and doing like on outreach. So what tends to happen is that a lot of the local Aboriginal land councils or Aboriginal services that may operate in a small community would have particular outreach health services come, like optometry, podiatry, but it's difficult for the elders in community to get themselves there, you know what I mean, without that practical help of having workers within the health system coming and collecting them and taking them there. It's quite it's very complex. It's very complex for the elders in community, or for the to get a doctor's appointment, or to get to get your health needs met in remote areas.
There's one small thing that when you mentioned podiatry and so forth, and I was also thinking as you were speaking, as I read your statement about dentistry, and it's been a kind of, I don't know, in the last election, a number of people raised the question about whether Medicare should cover dentistry, which I think it should, and the connection between mouth, what do you call it? Mouth health, oral health. Thank you. Sorry, mouth health sounds a bit funny, but oral health and other conditions as well is important, but also in terms of employment as well. You know, that you find that women or women or men actually with poor aesthetic things. It's a very large, it conveys an impression, whether we like it or not. It conveys an impression which can provide a very large obstacle to employment and other kinds of things like access to housing, for example, as well, as a renter, that somebody, in the way that somebody presents. And I'm wondering as you were speaking, I was sort of thinking, in the United States, in the South, there's a kind of foundation or something that has a mobile van and that travels around the health conditions. And I'm wondering, in some cases, obviously, this is not going to be satisfactory, a mobile van for abortion or some health conditions. But would that be some kind of solution, a greater reliance on those, and the pressing for oral health?
So there used to be, and I guess it all comes down to funding out to remote areas as well. That I remember a few decades ago, there used to be a dental van that used to go out to remote areas and do just probably the basic oral treatment for kiddies within schools. But I don't recall for adults or elderly in the community that was available or accessible either. I know for Aboriginal people, dental is a major problem out around country areas, and it's neglected on a large scale, and much needed. I mean, if they had to get dental treatment, they would have to book into an AMS in Dubbo, and waiting periods are crazy. Like Orange, Sydney has AMS, but let me tell you, there's a lot of complex issues there in trying to get treatment. The dental hospital is in Sydney is a lot of people come down from the country to access that, but it's still long waiting times for people to get treatment done.
Kerry, you asked yours as a question.
Part of what I was referring to about nurse practitioners is trying to overcome some of what you're talking about. The nurse practitioner goes to the community, but there's not enough nurse practitioners, clearly, as there are communities that require the services of one. The other thing is I'm aware that a lot of dentists are seriously thinking and have already started to commit themselves to their services being provided on a time about basis, not a permanent basis, to travel to remote communities just to deal with the dental issues that are there at that moment, not about ones coming up or people, no prevention, just acute dental issues. It's on the initiative of the dentists only. There's no organisation that can coordinate or bring those services to these people. I agree with the point you're making. How do you get people to know about the needs, as well as getting the individuals who are prepared to offer services out to those places? Thank you.
Thank you. And it doesn't take when you go out into community and it doesn't take Einstein to see in community the impact of oral health, because it's extraordinarily shocking to see that people are suffering with dental issues and not being able to get into and the other thing is travel, traveling to a regional town to get these appointments. Some people poverty is another thing in communities for Aboriginal people, and they just don't have they can't access transport to get themselves to and from places, or money at that. Yeah.
Just if I can follow up on that one, but you see, we know that there have been travelling services for mammograms. I know that at one stage that was actually a travelling service. Another travelling service was when there was concern that tuberculosis was coming back, the vans went round doing, giving the children from school in vaccinations and so on. So there have been these travelling programs around particular conditions, I suppose. So there'd be nothing really to stop if the government introduced such a proposal for a travelling dental service that would go to a town and that all the children and the elders and the others could line up and go in for inspections for their teeth. But that would work, would it? If there were regular services of that nature with dates made known to the particular remote communities, they're coming at such and such a time, such and such a date, would that work?
Well, if funding permits, wouldn't that be extraordinary for those people living in the remote areas out in around Australia? Wouldn't that be a great thing to bring that back? I remember as a little girl, I used the van used to come around, and then I think it just stopped. And I know I am aware that there are doctors that are trying to get together a travelling van going out to different communities to look at Indigenous health around diabetes and other issues like that.
Yeah. Just really quickly on paragraph 7 about the abortion, Canberra, that is the local ACT, Australian Capital Territory Authority, has brought in free access to abortion or termination of pregnancy as a right, because that is a right and they've recognised that. So that's something that could be lobbied for. I'm not putting the burden on you, Charmaigne, but that can be lobbied for with this new government having come into New South Wales. And just unless somebody else has got a really pressing issue, I'm looking at paragraph 8. The level of violence, this is talking about criminal assault at home and other forms of domestic violence, the level of violence is often worse in the country because of greater access to weapons. So are they able to get a licence because they say they're shooting rabbits or kangaroos? Is that what it is?
Absolutely, and the monetary thing is you can get a licence to become a shooter to shoot either kangaroos for purpose of business for selling skins. So it's quite easy for farmers to get licensed to shoot, and there is and there's so many different access to different weapons out. You know, you got axes, you got everything that in community that, you know, that people would like shovels, and you know, there's so many different access to it than what urban living is down here. So and quite easy for to be able to obtain a shooter's license.
Yeah, right. Good. Now we've got 2 more minutes. Somebody with a pressing question. No. I think this has been a wonderful, we've really appreciated having you, and to have that remote and rural contribution is hugely enormous, because as you know, it is in CEDAW that we must pay attention, and Australia is one of those countries where remote and rural communities are central to how we operate and need to be more on the agenda. So we appreciate it very much.
Well, thank you. And absolutely, like, you know, all women have a right to, you know, access and services, and to be able to get help, like even if you're in a remote area, you know, even though it takes longer for services to get to you, but, you know, I think the main concern is our young women out in community too. Like, they're not sure where to go, how to access services, you know, and they are too far away, you know, and it's too hard if they don't have transport, or for mums with babies even, you know, it's very complex for them. So they just stay in a relationship where it's not healthy.
Yeah, that's right. And I won't extend this because we've got our next witness coming, but I do want to say, and I know that Kerry would be able to speak about this with you, but we can't do it at the moment. But when the New South Wales Women's Advisory Council was operating from 1977 through at least the early 80s, I was on it, and I know that we had a major country visits program where we get a woman in the country to organise at a hall or a venue, and we would all go out and therefore talk to the women in the country to bring their issues back to the Premier, so that the Premier would have to pay attention to what the Women's Advisory Council was saying. So this sort of approach needs to be reinstituted. So yeah, thanks so much.
Absolutely. Yeah, thank you. Thank you. Thank you, judges. Thank you very much.
Can I just simply say that is something that when you are wanting to organise all these disparate needs for the community, you could lobby your local member to try and get to have a policy for the women of the Aboriginal women, or any women in rural areas.
And I think, like, given Australia's political climate right now, like, you know, you got leaders that are coming out with who are facing discrimination themselves, you know, and we've got the voice to be enshrined, and so let's hope, you know, that something comes good for Aboriginal women and children in this country, because they're always left on the back burner.
Yeah, put to the front, exactly. The voice.
Yeah, put to the front, and give them a quality of life, and you know, and you know, rise above the poverty that we suffer as well.
Thank you. Thanks so much.
Thank you,
Charmaigne. Thank you.
It's been a great honour to have you here, Sharon. Thank you.
Thank you very much.